COVID-19 pandemic has led to innovative utilization of the electronic health record in efforts to combat the pandemic. Hello, my name is Dr. Benjamin Satterfield. I'm a clinician investigator and fellow of cardiovascular diseases at Mayo Clinic. Our new article titled Leveraging the Electronic Health Record to Address the COVID-19 Pandemic will appear in Mayo Clinic Proceedings. In our article, we review how the electronic health record, or EHR, has been utilized for COVID-19 surveillance, contact tracing, identifying genetic susceptibility variants, patient risk stratification, and real-time in-hospital patient monitoring. We also discuss how these approaches have allowed researchers to gain insights into COVID-19 risk factors, pathophysiology, disease complications, and drug repurposing. The pandemic has led to the creation of a number of large consortia that are identifying factors influencing susceptibility to COVID-19 and disease severity. This is being done through linkage of various types of omics data, like genomics, proteomics, and metabolomics, to EHR data, providing a powerful tool to address these questions. There's actually a variety of ways that this impacts clinical practice. One notable change is the inclusion of host genetic variants of COVID-19 susceptibility in the EHR that may prompt early hospitalization or closer monitoring in patients with these variants. Additionally, as more variants are discovered, we anticipate the creation of a polygenic risk score to predict disease severity. Another will be the implementation of clinical decision aids that will use information from the EHR to alert clinicians in real time when patients are at high risk of developing various complications secondary to COVID-19, such as impending respiratory failure, left ventricular dysfunction, thromboembolism, etc. The more integrated that omics data, clinical decision support, and artificial intelligence become in the EHR, the better that overburdened clinicians will be able to care for hospitalized patients and hopefully lead to better outcomes, as well as perhaps assisting in understanding and treating the long-term effects being observed in COVID-19 survivors. Electronic algorithms will soon be published that allow for rapid identification of patients within a health system's EHR that have developed various complications secondary to COVID-19. This will allow for a better understanding of the prevalence of these complications and associations with morbidity and mortality, as well as allow for monitoring of long-term effects in COVID-19 survivors, which all fields of medicine will be dealing with for years to come.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.